Is at one of the shelters that has been set up for people who need to evacuate within a 2-mile radius.
Yeah, and the big thing right now is people want to know a lot of questions, right, about the smoke, about what exactly was the cause and how long this thing is going to continue. We do have an expert talking about the health standpoint of the situation, Dr. Jeffrey Kuo of Ochsner Healthcare. So, Dr. Kuo, thank you so much for joining us. Really appreciate it. I've started this question off with a lot of our experts who've come on our show so far. I got to ask you the same thing. When you saw the fire and heard about the chemical that is in those flames and the smoke, what was your initial reaction?
You know, it's a great question. And I mean, obviously, we're all human, even as healthcare workers. And the first thoughts that come to our mind are always, goodness, what's going on with the folks at the plant that are working there and the folks that live around the plant. And then the second part of it then becomes the health of those people and the folks in that community. Are there needs of those people? Do we need to start evacuating folks? And of course, you know, I think that anyone who lives in the river parishes, and in fact, I'm from one of the river parishes, you know, we know that this is an inherent danger that comes with residing in areas where there are large chemical plants. But you never expect it to happen, although you know that it's a distinct possibility. And so folks in that area need to understand that it's a collaborative effort amongst a lot of different people to ensure the health and safety of everyone in that community. And I will say that I know for a fact that emergency operations and fire departments and law enforcement and EMS and the hospital systems are all working together along with the plant's emergency operations folks to ensure the safety of everyone in that area.
Safety is so paramount. What are your immediate concerns right now for the people who, like you said, are forced to stay in that area because they are working on containing this fire or keeping it under control? What are your immediate concerns for them, as well as people who are not in that 2-mile radius but are still nearby that refinery?
Yeah, the folks that are within that 2-mile radius, ideally speaking, the majority of them are getting out now, right? And that was a very intentional decision that was made because of, as you mentioned earlier, the plume. You know, there's particulate matter within that plume. Although the current state, the DEQ, or the Department of Environmental Quality, is monitoring the air quality in that area, and they're not seeing any of the chemical that would be of concern. Despite that, out of an overabundance of caution, we're evacuating that area within that 2-mile radius. External of that, or extending beyond that 2-mile radius, we also have to understand that there are other areas within that location that do run the risk of having smoke inhalation and other exposures. And so we know that there's going to be folks that are probably going to encounter that. And I know that you mentioned it earlier, the plume of smoke is pretty thick where you are. And so we start thinking as healthcare providers, what are the biggest concerns that we have? And a lot of this is just folks with underlying respiratory illnesses such as asthma. If you start to inhale smoke, you run the risk of having an asthma exacerbation or an asthma attack, which would require you to come to one of our hospitals. And so in the river parishes, there are a number of facilities that are well equipped to manage any patient that would need to come in. And so we've already been in contact with emergency operations to make sure that each of those facilities is ready. The healthcare providers, including the physicians, the APPs, the nursing staff, and so on and so forth, have protective equipment. And we are, in fact, through emergency management, bringing more equipment in as we speak to ensure that we have adequate numbers of folks that are well protected to be able to take care of the folks that are there.
The biggest thing right now is making sure folks are staying safe and also that this fire is contained. Doctor, thank you so much for joining us. Dr. Jeffrey Kuo of Ochsner Health. Thank you so much. Really appreciate it.
It's my pleasure. If I will just say one thing, folks that are outside of that 2-mile radius, please shelter in place. Don't try to come out there for the safety of our first responders and so that they can continue to access and move about freely. Make sure that you shelter in place. Keep yourself safe also, because the smoke is coming potentially with the wind changing directions and such. And so just be safe, stay in place until you're told to do otherwise.